Not only is this hospital going to be providing a significant amount of services for people who make up their local catchment area, but it's significant for people in the hinterland as well.
This will be a state-of-the-art hospital providing both private and public health care, and what else could the people of Midland want?
Christian healthcare provider St John of God has recently announced that it will not be providing some reproductive services at its new Midland Health Campus hospitals due to religious values. This has prompted public debate on whether public healthcare services should be run by religious institutions or if they should be strictly secular. Today, Undercurrent spoke to Green Senator Lynn McLaren to hear her view on this important issue.
During the recent budget hearings, information was revealed about a contract that the government gave to St. John of God to provide health services. Now, Midland's been desperate for a new hospital, and it's time finally for the government to invest $5 billion on a new campus at Midland. The contract was awarded to St. John of God. It was quite disturbing to find out that contraceptive services, women's abortions, men's vasectomies, IVF services, none of them will be provided at the hospital. Instead, the government had cobbled together some sort of arrangement so that those services would be provided entirely separated from the main hospital services.
There is still some stigma attached to procedures such as abortion, sterilisation and IVF in Australia. Ms McLaren fears that referring these patients for treatment at a clinic isolated from the main Midland Hospital will only exacerbate this.
Well, I mean, put yourself in the place of someone who's in particular looking for contraceptive services or an abortion. Not an easy choice, not something that is a simple task either, you know. Historically, we have found that the best way to meet health services required by people is to offer them just in the mainstream hospital, you know, so it's just like any other service that you need. Offering it as a separate clinic immediately really discriminates against those patients because they've got to go into a separate entrance. They're isolated from the rest of hospital services.
Ms McLaren says it is important public hospitals like this one at Midland Health Campus be secular to ensure there is no discrimination in the services they provide for religious values or any other.
I think in particular it discriminates against women. You know, the right to choose, the right to our bodies, the right to an abortion has been hard fought. And it discriminates against women who want services to protect their, health. And, I think that's why people have been rightly taken aback by this decision in 2014 to separate out contraceptive services. It's quite shockingly outdated.
Ms McLaren ended by calling for a complete separation of the church and state healthcare facilities in WA in the future.
It's to ensure that we have a fair and equal society, that we all have access to the basic rights, the essential services that we demand from our public, as I've said many times, taxpayer-funded services. So essential services should be provided irregardless of faith or belief. It should be provided on basic human rights.
St John of God Healthcare declined to comment when asked. Though this issue is controversial, today's interview suggests that church-operated healthcare services do discriminate against some types of patients. This has been Alicia Pereira reporting for Undercurrent.